Hey there, this is Ben Thompson. I'm making this video because it's a new month. It's August 2021, and every month I put out an up-to-date informational video about what's happening in the world of hearing and tinnitus, and this month is no different. So let's get right into it. I have some important announcements and updates. I'm hiring other audiologists to join my team. You might be asking why. I'll explain that on this video. I also had a focus group. We asked them what they wanted in terms of professional help with tinnitus. They responded with some great feedback. Because of that, I've changed the services and pricing to make it more affordable on my website. So we're going to talk about that in just a moment. Another big update is that Bose, the technology company, now makes hearing aids. Currently in 4 states, you can get hearing aids from Bose, and I'm going to explain why that might be a good idea and why that might be a bad idea for your individual case. And then we'll wrap it up with this video talking about ways you can get involved with the community here. So let's start with number 1. Why did I decide to hire other audiologists? Well, I've been thinking long and hard about what to do because I've been in a tough situation. I have received amazing feedback, and I'm grateful for all of you who have reached out to me to have professional consultation for tinnitus. And I've been doing my absolute best to help you with my expertise in tinnitus retraining therapy, as well as mindfulness and a holistic view on how to handle tinnitus and hyperacusis. Now, I've been doing that for a few months full time. A few months ago, I quit my part-time job and I was happily able to transition into this role of tinnitus consultant full-time. And after doing it for a few months, sometimes I was working 40 or 50-hour weeks doing tinnitus consultations, and I realized that it was a recipe to get completely burnt out because I was spending too much time doing the consultations, just too much time in that mode of one-on-one. So I thought, well, what can I really do here? I wanted to make a decision about creating services for you, for anyone like you who needs professional consultation for their tinnitus. And I was thinking, well, I have 3 options. I can make an online course so that my message gets out to many people. I can increase my prices so that I'm having less appointments, or I can hire other expert audiologists to join my team, have the right training and expertise to be able to help more people at a reasonable price. So I was thinking long and hard. Personally, I don't feel that an online course is the best modality to help someone with tinnitus. There's so many nuances, there's so many individualized questions. So to sit through 5 to 10 hours of an online course waiting for your answers, to me, that's not the ideal situation for you who needs help. So online course, no go. The raising my prices, I didn't want to do that because that doesn't seem sustainable and I want to help many people at a reasonable price. So I decided to look into hiring other audiologists, trying to find some good audiologists based in the United States. So that's an exciting update that is going very well, finding great people who have more experience than me in audiology. So collaborating together is going to be a great force, a great help to those who are looking for telehealth tinnitus consultations. Now, second point here is that we recently did a focus group at the end of one of the group coaching sessions we do every month, and I started to ask questions about different models of care, different options for someone who's going through the stages of tinnitus for what kind of help they need. And from that focus group, from that conversation, we realized that an initial 45-minute consultation is perfect. At that point, the audiologist can determine, what does this patient need? Do they need ongoing monthly support for a period of 3 to 6 months? Or are they in an urgent care phase where they need to be seen on a weekly basis? At that first 45-minute consultation, now we determined that the audiologist will be able to make that call. We set up the follow-up appointments for 30 minutes each, and that allowed us a few things. Number 1, it allowed us to have the audiologist see more patients during the day. That's great for the whole system of healthcare, as well as have the patient have continuous appointments with one audiologist who's managing their whole case. Now, what we also saw from the feedback was that if we're meeting as an audiologist with the patient, then we're meeting about once a month for most cases for an ongoing basis. And what about those times in between? Well, we also added text responses within a business day, whether that's email or the business text phone number, that you working with an audiologist expert in tinnitus will be able to ask questions and have your questions answered when you go with one of these plans that we're putting out. Additionally, having a premium option or a pro option, what I call a holistic option, which is working with an audiologist, having that text communication as needed, and then also having multiple consultations per month with a health coach and a tinnitus wellness consultation, a tinnitus wellness coach. We're going to have a fun announcement coming soon about who exactly that is. You may have seen them on the previous podcasts as a health coach, so that may be a clue for anyone who's following this closely. And then we're going to be really excited to announce that. So this is already live on our website, this slight change in the pricing to make it more affordable and the overall structure of the appointments, so you or anyone who's watching who needs help can get the right kind of help and have an ongoing support with one professional who really understands tinnitus, managing the case over time. I think that's really cool, and another exciting update, because I'm always trying to innovate. Being an audiologist in a hospital, in a private clinic, I felt like the system was old and it needed to be matched with the current state of technology, right? To be able to have telehealth appointments via Zoom video, that's where we are in 2021. This is not something crazy or wild to be able to meet with a doctor and have a consultation via video. Of course, there are certain times when it's better to go in person, and we're obviously making that call as well, encouraging when that's necessary, go in person. However, it should be encouraged for our system in general to be welcoming technology if it serves the patient, serves the client better, and it's more convenient and can be done at a better price. Then that's a win-win-win for everyone. A big announcement here is that I'm linking up with the company Bose. Bose is producing hearing aids, and that's, well, you might think, wow, Bose is producing hearing aids. Yeah, I had to do a double take as well. But they recently released hearing aids that are under $1,000 in 4 states in the United States. And this is a big development. It has the whole industry of audiology talking about, what does this mean? Is this going to affect the industry in general? It's coming under the Over-the-Counter Hearing Aid Act, and that general wave of technology products that are direct to consumer or over the counter, which you can buy online. So I think it's going to change a lot. And because of that, I'm trying my best to be innovative and match the market changing by providing services and consultations where we can actually get the right hearing aids for someone. Not everyone who has a hearing loss would benefit from the Bose hearing aids. In fact, most probably wouldn't, especially if they tried to do it themselves. The company Bose, I just reviewed the whole process. I put the hearing aids on my ears. I got them shipped to my house. Overall, they were good for mild to moderate hearing loss. However, there are some nuances. So some innovation that I'm trying to bring is to bring professional audiology telehealth consultation to someone who might be interested in saving money and getting Bose hearing aids online instead of going to a clinic and paying $3,000, $4,000, $5,000. You could buy them online from Bose and get them under $1,000. Obviously, that's a big decision and still an investment, not something you should just do to try it and see how it goes. Having an audiologist review an online hearing check, an online hearing screening, or an in-person audiogram that you got from a local clinic, having an independent audiologist review that, walk you through all the different options for hearing treatment, to me, that's highly valuable. It's something that I would pay for, or I would want my parents or grandparents to consider paying for to get the expert independent opinion. So because of that, I'm planning to have our team of audiologists provide those services, and that's going to be innovative, something that I've been working hard on brainstorming, and something that I believe we need. Now, as we're wrapping up here, I invite you to please join the community. If you're watching this, you are certainly a member of the community. Thank you. And you have a personal invitation from me to join the community. And that just means to subscribe if you're not already to this YouTube channel. And then also on the YouTube channel, check the community tab where we have different polls and different questions so that you get to give feedback for what kind of videos you want to see. As we're wrapping up here, I welcome you to reach out if you have questions. Reach out to our team. We're glad to help. We love speaking on the phone, via email, text, whatever is comfortable for you. Just reach out and we'll get back. At the bottom of this video, my request for you is to please write a comment on what kind of questions do you have about the Bose hearing aid. I'm going to break it down into 3 categories. You just have to write one word for your comment, and this way I know you're listening and I know you're paying attention. Just write one word in the comment. What are your main questions about the Bose hearing aid? Question number 1, quality. If you're wondering, is it a quality hearing aid? Is it actually any good? Then write quality. Option number 2, effectiveness. Will it actually work to treat my hearing loss? Will it be effective to treat my hearing loss? And then number 3, how? How will it get shipped to my house? How will I put it on my ears? How will I know it's working? Right? How, if you're wondering how the logistics of it will actually work. Would really appreciate that response. Thank you again for joining this monthly video newsletter. This is your host, Dr. Ben Thompson. I try my best to make videos that matter, to make videos that will potentially help. As an audiologist in this digital world, I say thank you, and I wish you have a great rest of your month and a great month to come. Bye-bye.